Now that the so-called big beautiful bill has been passed and signed into law by the president, we're going to talk about more in detail how that's going to affect your Medicaid, those for you or those around you, your friends, relatives, community, next door neighbors, how it's going to affect your Medicare, how it's going to affect your Social Security, all the rest of it. And so we'll go into each one of those and some action items that you definitely need to take care of to make sure that this doesn't affect you, even though, okay, here's the deal. I did a video a couple of days ago on the big beautiful bill and what is involved in it, and I got a bunch of comments, and there's kind of two groups. There's one group that realizes you can't take $1 trillion out of the healthcare system like that and it not have trickle down effects to everything else. And then even if you're not receiving Medicaid, or even if you're receiving Medicaid and you think you're untouchable because you're a U.S. citizen and you're elderly or disabled, whatever the case may be, there's one element, there's about half of the people out there that comment that says, yeah, they know this is bad. They know this is bad. And you've got another part of people out there that don't think anything is going to happen negatively. Everything is positive. So basically what they're saying, I hope it's the second group, because what they're saying is the second group trusts their federal politicians 100%. They think that the 900 pages of law they wrote is perfect, and every single period and comma and phrase, and everything was done perfectly, even though a lot of this stuff was done at the last minute and the people didn't even read it, but it's perfect. It's exactly what it needs to be. And that lobbyists obviously weren't in there, digging their fingers in there and getting a little bit of money here. That didn't happen. That didn't happen. So the second group doesn't think. And they think that the states and their local governments are 100% perfect, and they will interpret the laws perfectly. And their local Medicaid office and their Social Security offices and their Medicare offices will be 100% perfect. They are fully staffed, and the staff has all the time in the world to make sure they do exactly perfect, exactly like the politicians wrote this thing. And the same group thinks that private companies like the Medicare Advantage companies and the Part D companies, those guys are going to be perfect, and they're not going to use this as an opportunity to make more money and essentially screw the American people for their quarterly profits. There's a lot of faith on some, yeah. So I hope you're right, but I've been in the government. I ran the third business Social Security office in the country. Before that, I worked at a Medicaid office doing social services. I was a sergeant in the Marine Corps, so I've spent quite a few years in and outside the government. And unless you know something I do, then I think we're going to be kind of a lot of people out there, millions of people are going to be in a world of hurt. So okay, so let's get into the details here. Here's kind of how I see it. I picked a little video from a famous movie, The Big Short.
Double B's, 0. Triple B's, 0. And then that happens.
What is that?
That's America's housing market. Double B's.
So
0.
this is what we've got, basically, is... let me shut that up. All right, so... the American healthcare system has been a Jenga tower for a long time. It's been a Jenga tower. I mean, it's, I don't need to tell you. It's been in a precarious situation for a long time. And now you're taking $1 trillion out of it. You're kicking millions of people off there. And see, some people think, okay, all those millions of people, they deserve to be kicked off for whatever reason. Okay. But the Jenga tower it's not the housing market as it was in 2008. This, I think, is the Jenga tower of the American healthcare system. And I'll get into that, exactly how that's going to affect, doctors trying to become doctors, pre-med going into doctors, your healthcare system, getting, medical equipment, all the rest of it, prices of the Affordable Care Act. So I'm going to go over there. I'm going to go into a few of these today, but I don't want to spend a whole bunch of time on this. This is going to be kind of a multi-part discussion, because we also need to kind of take a breath a little bit, because the law has passed. And with any type of laws like this, the devil is in the details. And the politicians, I know a lot of you out there have 100%, faith in these politicians that they did everything perfectly. A lot of us don't. And we think the repercussions are going to be seen, those unseen repercussions. So I might be sitting here talking about this today, and then a month later, I have to come back and say, oh my gosh, did you know this affects this? And therefore, because of this, this, and this, these companies have taken advantage of that and did this, or the state governments. Here's one thing I definitely are going to see. We see a lot of these particular policies, they don't take effect until, a few months from now or next year, or whatever the case may be. But I think there's a lot of states that are going to take a preemptive strike, use an old Marine Corps thing here. They're going to take a preemptive strike, and they're going to say, look, we need to plan for our budget next year, our state budget next year, or the year after. And we see hundreds of billions of dollars not coming in for the federal government to cover the people in our particular state. So, for the budget for this coming budget, we're just going to go ahead and start slashing stuff now, because it's not going to come in the future. So let's just go ahead and start slashing now. And I see a lot of states out there that are probably going to be eyeing that. And so what we think won't start until next year, 2 years from now, it just might start sooner. And so here's your action policy. So since the federal government, they've done their thing, they've thrown the dice, now it's up to the states and the local government. So now it's time to move. We lost, a lot of us, lost the battle on, cutting Medicaid and Medicare, and Medicare is going to be cut. I've got some video questions about that. I'll answer that in a little bit. But now we need to move our focus to your particular states. So contact your state representative. I already got a question in here. Let me go and pop up the question. Nancy says, I got an email from one of the senator's reps in my state. I'm in Indiana, and it wishes me a happy 4th. Yes, happy 4th of July, everybody. And it had a link to email how they could serve me. So if this is a state representative, reach out to them and say, hey, you know the deal. You're going to be getting cut. You're going to, all these laws are coming down, and the states have to administer these, because Medicaid and a lot of these programs are, federal state programs. Reach out to those people, those state representatives, and say, don't do anything stupid. Don't do anything. Tell a politician not to do anything stupid is probably stupid in and of itself. Going to it a little, anyway. But reach out to them and tell them, hey, you're going to have all these people down here, and okay, if you're on that group that thinks politicians and all these are perfect, then you need to call your politicians and say, hey, I know you guys are perfect, but the local government offices, the Medicaid offices, social services, they are completely understaffed. And as we saw after the end of COVID, there was about 75% of the people that were cut off of Medicaid shouldn't have been cut off, because of just stupid little paperwork thing. And this is one of the things that's basically written into the law. They canceled some of the provisions to make all of this easier for people. The documentation, they canceled all that. So the documentation, all of that is going to be very, very difficult. If you miss a deadline, if you don't forget to check this box, if you date it incorrectly, whatever the case may be, you're going to get canceled. If you're entitled to those benefits, you're eligible for those benefits, then once you jump through all the hoops, you'll be able to get it back. But that might take a month or 2 months or 3 months, and a lot of aggravation. So this is one of the things I'm doing right now. I'm working on a new website in addition to my website. I've got, if you're new to my channel, I've got a website that I put all of my decades of experience in Social Security, Medicaid, and everything. So for retirement, disability, survivor benefits, Medicare, Medicaid, and I've got a section on Medicaid there, living on Social Security alone. But I'm coming up with a new part of this called Dr. Ed's Community Core. Got to call it the core, right? Where y'all can help each other. So if you're an expert, I know that we've got a lot of experts in this in our community here. You know, people in Indiana like Nancy that maybe you've helped a friend or relative with Medicaid or something like that. I am depending on you, Nancy, and all the other Nancys and Bellas and all of y'all out there to, once I get this up, we need your help, because the government of the people, by the people, for the people, yeah, not so much. So we have to take it upon ourselves to go out there and help our fellow citizens, you know, navigate this bureaucracy so they're not cut in there. Again, there's a group of people think politicians and these government workers, they've got scalpels and they're going to go in there surgical precision and they're going to kick out, suppose, of those illegals, even though illegals by near definition aren't supposed to be receiving Medicaid, which they don't receive Social Security. But anyway, but if you think that, you think that. But you also have to think that these politicians are going in there with a scalpel rather than a bazooka, which unfortunately, that's what's going to happen. Okay, so let's get into a little bit of the details. But again, a lot of this stuff is going to wash out, and we're going to see exactly how it comes into fruition. But in terms of how it is right now, so we've got Medicaid cuts. We're talking about $1 trillion over 10 years, and you just can't, could you imagine your own household taking out, 15, 17% of your income, and you're like, oh, okay, no problem, right? And the states now have more flexibility to recheck eligibility, and this is key. So more opportunity for you to make the wrong decision, to not get those, to fill out the incorrect forms, to not get those forms in at the right time. And even if 100% you are eligible, even if you are 100% eligible, doesn't matter. Doesn't matter. If you don't fill out everything perfectly and your local office doesn't, adjudicate it, complete it in time, you just might be without. So this is where we're going to put together this website, and we're going to put together a community to help you all out. So there's moratorium on the streamlining. So that's what I was talking about. There was a law that was passed about a year or so ago, and then said, hey, all of this is just way, way too difficult for seniors. They get the Medicare Savings Program, which is, if you got Medicaid, they pay for your Part B. A lot of people are going to lose that $185 Part B Medicare Savings Program. But there was streamlining law that was passed. That has been, no, we're not going to make it easier for people. We're going to, why? Why did they roll that back? Why did they say, hey, there's a law in the books that makes it easier for people to get what they need? No, we're not going to do that. Let's delay that till like 2035. Let people, suffer for the next 10 years. So, I mean, that makes no sense whatsoever. The Medicaid Navigator Assistance is slashed. So this is a program out there to help you navigate the bureaucracy and get your Medicaid if you need to. And if you're a nursing home, children, pregnant, disabled, whatever the case may be, that has been slashed. So that's one of the reasons we're putting this program together. Work requirements. So that is going to be a nightmare. So some people you think, okay, should be working. Okay. Even if they're working, a lot of the jobs out there, like the billion-dollar companies don't even provide health insurance. So they need Medicaid on top of that as well. And so the work requirements, if you don't do 80 hours, then you just might be cut off. There's supposedly some type of gray area there where if you don't do it, if you're like 79 hours for like 3 months, then you're definitely cut off. But if you're only down 79 hours for 1 month, they give you kind of a gray area. But the states have complete authority on determining kind of these gray areas. So each state is going to be a little bit different. That's why you need to reach out to your politicians. And these work requirements, Georgia and other places did this, Arkansas, and they found out it costs so much more money. Like, for example, Georgia, they spent $90 million administering these programs. And if they just gave these people health care, it would have cost them $26 million. But they spent an extra $90 million, administering this program, and it just completely, talk about fraud, waste, and abuse. So the state Medicaid trigger avalanche. So so in terms of, the work requirements. It's not every state. There's about 9 states or so that have already got these kind of work where they didn't expand. They didn't do that Medicaid expansion. So if you're one of those states that is listed there, the work requirements not really an issue because if you really didn't have it in those particular states anyway. So what we're going to see is these automatic trigger cuts by the states. So this is why we need to move our focus because the federal government, they've done their thing. We couldn't do anything about that, but now it's time to turn to the states and make sure they don't make all these crazy changes. And then one last thing, I've got a bunch of other ones I want to talk about. Medical school, getting new doctors. I want to talk about private insurance and stuff, but I don't want to spend too much time. I'll make another video in a couple of days with the rest of the details. Any other changes, I want to get into a bunch of questions as well. But Social Security is also going to hurt. The Social Security trustees just came out with their estimation of the trust fund. And we want to make sure for all the new viewers out there, the Social Security Administration, if we don't privatize it, if we don't give it over to the billionaires, the Social Security will be around here for hundreds of years. Okay? That's not the issue. The issue is how much you will get from Social Security. Because the trust fund is running out in 2033, it was at 2034, and then it's 2033, and now because of this big, beautiful bill, it's going to be cut sooner and more. So now we're looking at about 24% cuts across the board. Everybody. There is no exceptions. There is no grandfathering in or anything like that. So if you're receiving Social Security benefits as of right now, we're looking at about 2032 where you're going to get about a 24% cut in benefits because the taxes on Social Security. Okay. You've all probably received an email, a really, really kind of bogus email, if you ask me, where the press office of Social Security, really get involved in politics, talking about tax relief for seniors. And it says the new law includes a provision that eliminates federal income taxes on Social Security benefits for most beneficiaries, providing relief to individuals and couples. No, it doesn't. No. A reconciliation law bill can't do that. It has to go through regular order. Can't do just the 51. No, that's not. They included a deduction, which doesn't help the people that really need it. So the people that make a lot of money doesn't help them. The people that make the 50% of people that make pretty much just Social Security and a little bit part-time jobs ain't going to help them. It's more for the middle class. So about 50% of people that are on Social Security don't even pay Social Security taxes to begin with. So it doesn't help them at all. So if you're all happy that, I don't have to pay, I got this email and this is great, I don't have to pay tax. No, you still have to pay taxes, but if you're in those particular groups. If you didn't pay taxes last year because your income is so low, this ain't going to affect you. Unfortunately, this is not going to help you. A lot of people are thinking this is some type of, it's a stimulus check, so I'm going to get a $6,000 stimulus check. And no, there is no stimulus checks on the horizon. So, all right. So I will make another video. We don't want to get too deep into the weeds. Once this stuff starts fleshing out, I'm going to make another video. Make sure you subscribe, like, and share and all that kind of good stuff. But let's go ahead and get into some actual questions. Let's see. I keep seeing $12,000 referred to along with SSA. What does it all mean? I just this month changed over from SSDI and widow's benefit check to Social Security full retirement age. One check for both. Okay. Yeah, so that's a normal thing. So you were receiving SSDI, Social Security disability, and widow's benefits on top of that. One offsets the other. So number one, Granite Boogie. Good on you. A lot of people don't realize that when they're receiving disability benefits, they're also, if they're eligible, they can also get other benefits like survivor benefits or spouse benefits or divorce spouse benefits or anything like that. You're one of the smart ones. You realize that. So please tell people out there, if they're on disability and they're eligible for any other benefits, getting survivor benefits like Granite Boogie here, getting survivor benefits doesn't stop your disability benefits. You continue to get your disability benefits And then if you're entitled to surviving spouse benefits, divorce spouse benefits, or whatever, it's just added on top of there. One offsets the other, so you just get that. So you'll essentially getting three things. You're getting your disability benefits, you're getting your Medicare continues because you still have disability, and you're getting that extra benefit. So there's unfortunately a lot of people out there that don't get it, and luckily Granite Boogie did. So what happens also is when you're receiving disability benefits, SSDI, once you hit your full retirement age, 67, 66, and 8 months, whatever the case may be, that is switched over to regular retirement benefits. So your widow's benefits continue forever. Your disability benefits switched over to regular retirement benefits. And so you're no longer on disability technically. You're just on regular retirement benefits and surviving spouse benefits, widow's benefits, widower benefits, same thing. And the key is, so the check and everything stayed the same, direct deposit stayed the same, but now you're free in the sense of, because you're not receiving disability benefits and you're past your full retirement age, you can work as much as you want. No work limitations whatsoever because you're not on disability. And because you're past your full retirement age, there's no more work limitations and no more CDRs. So if you're sitting around waiting for your continuing disability review to see if you're still disabled, you ain't going to get it. Never. Because you're not on disability. You're just on regular retirement. So yeah, there's a lot of people out there that on, receiving disability for a long time, and then they got switched to regular retirement, and someone offers them a job and they decline it. They're like 72 years old, and someone says, "Hey, can you hang out at my store for a little bit and watch it every now and then? I'll pay you a few $100 a week." "Oh, no, I can't do that because I'm on disability. And I'm afraid it's going to stop my disability and I'll lose my Medicare and stuff." No. You're not on disability. You're on regular retirement. Go get that job. So I think saving any amount of money people can come with, save it a little each month. Yes. Yep. So absolutely. Tracy, 77 million people voted for this guy. If one of these voters lost their medical insurance, do you think they would continue to support Trump? Any news? Unfortunately, there's people that are so far gone, they'll just blame Biden's laptop for their loss of Medicare. So what are you going to do? So let's see. Was listening to group indigenous people on environment said, oh, okay. Sure. Why would Social Security not notify the Department of Energy about permanent disability? Because, if you authorize it, then you can get an award letter and send it to the Department of Energy or the post office or whatever like that. But they don't do it automatically. So I am 65 on Social Security and receive Medicare Medicaid. I live in Florida. I only make $10.93 a month. I'm scared I will lose my Medicaid portion. Okay, so you're 65 years old. You've got Medicare, Medicaid. You might have one of those Medicare Advantage dual eligible plans because you got Medicare and Medicaid, and they also have those grocery cards. You can reach out to Chapter and see if one is available to you. Usually I'll always recommend Medicare supplement plans, but if you have Medicaid, you can't get a Medicare supplement plan anyway. And those Medicare Advantage plans, some of them, depends where you are, have those grocery cards so you can get an extra $100, $200 a month or something. So definitely check that out too. Okay, so you're on Medicaid and Medicare. You're only making $10.93 a month. So if everything goes 100% perfect, then they won't kick you off Medicaid. But the state of Florida, is the state of Florida. I can say that. I lived in Bradenton and Homestead for a long time before Homestead got destroyed by Hurricane Andrew. But anyway, even if you are 100% eligible for those benefits, you're a U.S. citizen or green card holder and you don't have $10,000 in the bank, and you are definitely 100% eligible for those. We just have to make certain that you don't fall through the cracks. That when you get this documentation, when they start sending out documentation for those recertifications to see if just to check to see if maybe you won a big lottery money and so they can kick you off, or you lost your U.S. citizen status, or whatever the case may be, you have to fill out all those forms. And if you don't get them back at the right time and fill out correctly, then there might be an issue. You'll get it back, but it's going to cause you a lot of pain, and you might not have it for a month or 2 months or 3 months. Usually in those particular situations, if the office messes up and they deny your Medicaid for a month or 2 months, and then they fix it later and they say, oops, we made a mistake, we lost the paperwork, everything, or whatever the case, they give you that retroactivity, but that doesn't alleviate your sleepless nights for 2 months. So we want to make sure we're preemptive, and that's why I'm putting this website together. Reach out to anybody locally that you know, so I'm gonna, we're gonna see what we can do to help people out there. So stay tuned. If you get any letters, anything strange, come back here. Or better yet, go onto my website. And go on to my website, and at the very bottom, you can't unfortunately see it, but on my website, on pretty much every page, on the bottom left, it has a little camera. So if you receive a weird letter like that from Medicaid and whoever that says, hey, we need to check this, that, and the other, when this whole process starts doing it, make a video. And don't give us any private information. Just say, hey, I got this letter. Don't show us the letter because it might have your private information on there. But say, hey, I just got this letter and it kind of says this, that I need to do this, that, and the other. And then we'll come up with a plan of attack. And we'll make sure people don't get cut off that are not supposed to be cut off. So, but all those people out there that have 100% faith in the government, then they don't worry about it. I got an email saying the bill ensures that, okay, yeah, I just talked about that one. Will I lose my Medicaid that pays for my 185 Medicare premium? That's going to be a big one, is that Medicare savings program. That one is going to be difficult. So the Medicare savings program, so this person has Medicaid, and there's different levels of Medicaid. There's called the QMB and the Slim B and the QI, and there's different levels of Medicaid. If you get the higher levels of Medicaid, the QMB and the Slim B and stuff like that, then what happens is the state pays for that $185 for your Medicare Part B premium. So that's $185 that you don't have to spend every month. And $185, that's a lot of money. But if the states stop getting money, matching money, and we're talking particularly, in a lot of these are red states that get a lot more. Like California, they pay more into taxes than they get back. Places like Mississippi and Louisiana, yeah, they are, I guess, sorry, but Reagan welfare queens, that's like Mississippi and Louisiana. They get a lot more welfare. They, unlike California, that pays a lot more to the federal government than they get back in resources, those states get a lot more than what they pay in because their economies is not as good. So those states are going to have a hard time. Their budgets are already razor thin, the state budgets. So they're going to be looking to cut back every place they possibly can. So you may keep Medicaid. You may still have Medicaid, but they might downgrade you. They might start downgrading people from QMB to just a regular Medicaid. And if that happens, then unfortunately, that $185 you're going to lose. So you're going to have to pay the $185 every month out of your Social Security check. And if you have one of those Medicare Advantage dual eligible plans that pay for a lot of other stuff and gives you $100 or $200 a month grocery card, because you don't have the higher levels of Medicaid, you can't continue to get a Medicare Advantage dual eligible plan because you're technically not dual eligible. You do have Medicaid, but you don't have the higher levels. So you're going to lose that gift card, or not the gift card, the grocery card, the $100, $200 or so. So $185 plus you're going to have to pay a lot of co-insurance and co-pays, lose your gift card. Yeah, it's going to be, but there's billionaires and giant corporations that are going to make out like bandits. And so that's consolation, I guess. So keep hitting a key next to send was listening to a group of indigenous people on Alligator Moat. Said cannot put sewer septic tanks in that swamp, ruins their water. Do they care? Oh, okay. So that's Alligator Alcatraz, right? grew up in and went to junior high in Homestead there, and so the airboats and alligators, and my grandfather or my uncle was an alligator wrestler. So yeah, I'm familiar with alligators. So I used to swim with the alligators. So, do you think more will complain the more benefits the government will take away? I think they care, and it shows. Happy Fourth, Doc. Yeah. Oh yeah. Yeah. And yes, so many more people are going to complain, and yeah, it's. I think I had a. Let me trying to find my little. I had a bunch of phrases. So okay, here we go. So here's the trending words for the next 12, 24 months. Here's what we're going to hear over and over and over. Wait, what? I didn't think that had anything to do with me, this big, beautiful bill. I didn't think this would hurt my family, hit my family. Why didn't anybody warn us? I thought Medicare was safe. I just assumed it wouldn't touch us. Yeah, we're going to hear that a lot. I thought I was good. I'm a U.S. citizen. I'm disabled. I'm 70 years old. I thought I was good. Well, yeah. Bruce, I'm really worried and scared because I'm on Medicaid and SNAP. I take insulin, blood pressure pills, and gastric pills. Yeah. We just have to reach out to your politicians and tell them, yeah, don't do anything stupid. But I was going to go into my Forrest Gump into imitation. Stupid is as stupid does, right? So. This is the most destructive bill ever passed. It will hurt hundreds, thousands of people of SNAP gone. It's a tragedy. Yes, I agree with you. And a lot of people don't realize it, but they will. Maybe not themselves. And if it doesn't happen to them, a lot of people, don't care. If it happens to the person, that little old lady down the street or something, they don't. Yeah, so. Penelope, what's up, Penelope? I think there would be plenty of changes once Trump is out of office. It will take a lot just to undo all the mess he has made. Yes, this is, yeah, of the people, for the people, and by the people. We definitely need to. Is there a sliding scale for the Social Security deduction on tax returns, a top income number? Social Security deduction on, well, what it is, what they passed is a deduction. It's what, $6,000 if you're single, $12,000 if you're married. And then it basically it's sliding, it's progressive, and then it's regressive. So the more you make over, what is 175,000, all this stuff was changed at the middle of the night, so it's hard to remember. If you make over 175,000, it starts kicking that back. So yeah, so that's why if you make, if you're making good money, then you don't get the deduction. If you make not very much money, then the deduction doesn't matter because it doesn't help you at all because you're already not paying taxes on your Social Security. So, and taxes on Social Security, everybody, pretty much this community, we all believe they should have never taxed Social Security benefits. That was a thing they started in the 1980s. It should never have been taxed. But it has been. And there's billions of dollars when you pay your taxes on Social Security. If you're one of the 40 or 50% that make more money, if you pay your taxes on Social Security, your Social Security benefits, that money doesn't go to the IRS general revenue. Well, it goes to the IRS, but it doesn't go to the general revenue. The IRS sends that money to Social Security, and Social Security puts it in the trust fund. Now that's gone. That's why Social Security benefits are going to be cut more and sooner. So. Grow filed for Social Security benefits on 5/1 and haven't heard back yet. Birthday is September to begin benefits. Should I visit local Social Security office to check? If you're talking about your birthday is this coming September, no, you're good. What happens is July, August, September. So you're in the auto adjudicate mode. You filed a bit too early, so an employee really shouldn't have taken that claim. Hopefully that employee is still there, because what happens is because they can't put it into the system that far out, they just kind of stuck it on their desk and they're going to do it. But hopefully, Elon Musk and Doge didn't, vacate that person from the premises, and your case is just sitting there and nobody's messing with it because they don't have staff. But what hopefully happened is once they were able to put it in the system, they put it in the system, they push the button, and then once the I don't want to get too in the sausage here, but once the month comes up, it'll automatically adjudicate, and then you'll get a letter and stuff. So right now, you should be good. You should be good. So it's just a matter of, yeah, you're still September. So I'm 55, legally blind since birth, been on SSI, Medicaid, and SNAP for over 20 years. Do I need to be worried about being cut off from everything? Everybody needs to, be worried in the sense of, the people that surgical precision, it's kicking off, the 26-year-old that should be working and that decides not to work or whatever, those people should definitely be worried. And everybody else, because even if you send in all your forms and everything, we just have to make sure you get in all your forms. We just have to make sure you do it at the right time, fill it out perfectly, and you need to call your politicians and make sure the local offices are staffed, those Medicaid offices or Medi-Cal offices, the Apple Care, Denali Care, whatever your state calls your Medicaid program. And that's another thing. A lot of people don't know they're on Medicaid because it's different, name in their particular state. But contact your politicians and say, hey, the local Medicaid office their workload is gonna shoot through the roof. You definitely need to put some people in there to make sure I don't get my stuff cut off, that my stuff doesn't sit on someone's desk for a month or 2 months or 3 months because I need my prescription. I need to go visit my doctor. I can't be cut off. And what is going to be tragic is all the kind of the secondary issues where, they lose your file or you forget to check out this little box or something on your application. And you're essentially denied, even though you shouldn't be. You're denied for a month. And then Social Security starts taking that $185 out of your check, and then you lose your Medicare Advantage plan, and you lose your food card, and after 2 or 3 months, you get it all back, hopefully. But yeah, it's. They say lots of hospitals will close. Yes. Congress recognized that. So yeah, it's one of those things where it's like they were saying one thing one day and they say, oh, no, that's not going to happen. Hospitals aren't going to close, right? No, what are you talking about? No, that's not going to happen. And then at the last minute, they say, oh, hospitals are pretty going to close. Let's put a $50 billion slush fund in there to help those hospitals because hospitals need help, but people that go to those hospitals, screw them. Anyway, yeah, so it's like, okay, politicians, well, our hospitals are going to close, or aren't they? They obviously put their money where their mouth is, and they believe, yes, they are going to close. But yeah, $50 billion. And I'm worried about that too, because the politicians are going to pick and choose their own hospitals. It's like, oh, there's a hospital over there with my name on it, Senator yada, yada, yada from Kentucky. I'll give them $20 billion of it and screw all the other states. Or, Lisa Murkowski, gives it all to, because, got that, the Kodiak kickback. I'm scared. I submitted my Social Security application with protected status, and they sent a message to call them some issues. Is that routine normal? I don't want to mess this thing up. Some wrong answers. Nope. No problem whatsoever. So they're doing their job. Good that they got it. So I'm not sure whether it's a retirement application, survivor, disability, Medicare application, whatever it is. But yeah, just call them up. Make sure it's not someone pretending to be Social Security. Call the local office or call the 800 number if you don't have the local office number and say, hey, I just got a call and I supposedly from my local Social Security office, and they can look in there. And they'll say, hey, you just say, hey, I got a pending claim. And they can look in there, oh, yeah, you got a pending claim. And they can see the unit code of the person that deals with it. It's normal. I've done hundreds of thousands of claims. And sometimes you just have questions. Are you sure you want to start your benefits this month? What about this month? And you said you mentioned you have kids. And so, or something's wrong with your earnings record or something. So, yep, no problem whatsoever. Just give them a call. Normal. It has been 6 months with this administration. Seems like an eternity. History. How many Social Security offices were forced to close to Doge? Not any, yeah, that was incorrect information. And Elon Musk was the king of incorrect Social Security information, but I don't want to follow his lead. There are some media outlets that said some offices were closed, but those were regional processing centers. There was 9 regional processing centers, and they closed some of them, which I kind of agree with 1 or 2 of those closing. But anyway, but field offices, customer-facing field offices, yeah, none of them were really closed. I think they closed down like an administrative law judge, satellite office and stuff like that. So, but offices, like in my case, I had my district office, and in the same building, we had one of those stupid Social Security card centers, which was an overreaction after 9/11, and we closed that one down. I closed that one down a few years ago. So, but they just consolidated everything into the district office. So sometimes offices close or they move. So yeah, Doge didn't. They tried to, but they weren't able to close down any offices. So. Margaret, what's up, Margaret? So thankful for Dr. Weir and your knowledge and help. We all appreciate you very much. I appreciate that. Thank you. I'm not searching there for compliments. Whichever one pops up on my screen, I push it. So sometimes I regret it. Sometimes I appreciate it. Thank you, Margaret. If you are an American living overseas but receive your check into an American bank account, is there a problem? No. I don't see anything. I think there was something hidden in there that people sending money overseas, if you're not a U.S. citizen, to like family and stuff like that, I think they're going to start charging, what is the final thing, 1 or 2% or something like that. So the IRS is going to start putting some type of tax on foreign remittances like that. So, but if you're a U.S. citizen, particularly sending it to yourself, I don't think I didn't see anything in there like that. Dr. Cornelius, I'm 35, healthy on SSI, Medicaid, and SNAP for 10 years. Do I need to start working, and what will happen to my band? Okay. If you're on SSI at 35, then you're on disability. So there's that. So because you're on disability, technically your Medicaid and everything should be good. But that really depends on what your state decides to do, whether they decide to, downgrade yours. And that's one of the things. If you're on, and you're on SSI, so you're probably not on Medicare. So if you're on SSI, you're categorically eligible for Medicaid, and so it streamlines a lot of that process. But now they decided, no, to make it easy for people, no, we don't want that. So they decided to suspend that law for 10 years to make y'all's life more difficult for 10 years. What happens if my brother was found disabled by Social Security but not getting SSI at age 15 and only received benefits under one parent's SSDI? When he turns 18 next year, what do we need to do with Social Security? Yeah, that's you normally only receive SSDI as a disabled adult child from one parent. There is some time you get a dual eligibility, but you normally get it from the highest parent that is receiving benefits. So if you have 2 parents receiving benefits, retirement or disability, whichever one is the higher amount, that's the one Social Security uses to file that disabled adult child benefits. So when he turns 18 next year, I would do a preemptive strike on this one because he's on SSI, so that means he's disabled. But they did his disability based on child disability criteria. When he turns 18, they will need to switch it to full adult disability, and then also on, Social Security disability, disabled adult child benefits. So I would start reaching out to your local office, have them reach out to the local office and say, hey, I'm turning 18 next year. So we want to make sure we convert everything and we don't miss anything. So definitely reach out to them. Research what may happen to nursing homes and their residents. This will impact assisted living as well. Yes, that's part of my kind of slideshow about medical equipment and nursing home and doctors, and it's going to affect everybody. It's going to affect the entire thing. Prices for everything are going to go up. Hospital emergency rooms are going to be packed. It's going to cost us more because if you give somebody health insurance and they have health insurance and they, have some type of issues, They have health insurance. They go get their preventative maintenance and, they get it taken care of. They get it controlled with medication or whatever the case may be. And it's so much cheaper that way. But if they don't, then they don't. And they just wait until it reaches critical mass, until it's life-threatening, or they just can't handle it anymore. And then they go to the emergency room and everything costs so much more, and they might have to be admitted to the hospital for something that they should have had, kind of taken care of along the way. But we decided to do it the expensive way. And we think it's the cheapest way by just cutting off, but it's actually the expensive way. So what wage equals about $14,000 annually? How do you live on $14,000? You need support from healthcare, food. Yes, absolutely. Absolutely. So Cecilia, I work for a public hospital and they have a lot of Medicaid patients on the roster. Even with a slush fund, I can't imagine we won't be affected, and staff layoffs could be possible at some point. Yeah, it's going to affect everybody. Yeah, those hospitals, there's about 900 hospitals that are kind of, razor thin, having financial issues. And now that, people are going to get cut off Medicaid and they're going to go to emergency rooms and the hospitals are going to be stuck with the bills. People are going to, their Affordable Care Act marketplace insurance prices are going to up. They estimate about 75%. So people are just going to, stop paying for the health insurance. And they're just, so hospitals, particularly rural hospitals, rurals out in the country, hospitals out in the, the desert out west. And those are really going to be difficult. And even if you're all good, you pay for your own health insurance and you're like, I don't care, none of this affects me. Yeah, go to the hospital in a year or two and let us know then. Jenga, right? I feel fortunate that I'm not only depending on Social Security, all of this craziness, I'm here to support. Kathy, you are too awesome. That's what we need more of. People that, none of this really affects me. It probably will. But right now, I've got my Social Security, I got my savings, I got my own health insurance. I'm good. But I know there are other people that are not as lucky, fortunate as us. So that's, of the people, by the people, and for the people. Stop spending, that will get their attention. They want you to spend your money. Okay, not sure what that is. This is live. I just press the buttons and read what it says. I don't have anybody helping me. It's just me, myself, and I. I'm late logging in. Did you talk about the email Social Security sent out about? Yes, I did. Yep. I certainly did. So this live, when I do these lives pretty much every day, what YouTube does is they put it into the archive. So if you want to see the whole thing, share it or something, then you just go onto my YouTube page and you click on the little live button, and then you can see everything. You can see everything. So you are purposely scaring people. I am presenting the facts of the reality of what happened. So yes, the reality is pretty scary. Should be getting Medicare for all. Instead, we are getting the social safety net ripped apart. Yeah. Let's see here. What else? If you are not scared, you are not paying attention. Bond, James Bond. I'm not scared. I'm mad as hell. Oh, yes. I was, that, was it from Broadcast? I think it was from that Eddie. Yelling out the window, or newscaster. I need to make a copy of that one. Will ICE be rounding up women without cosmetic surgery? Okay. Lisa, I'm 63. I will be 64 in September. I live in Arizona. I am disabled. I fall into the dual category. My check is $1040 per month. I'm afraid of losing my home. I don't know what to do. Contact your politicians. I know Arizona, in Arizona, they call Medicaid access, right? In Arizona, Arizona does things strange. But yeah, reach out to your politician and say, hey, I am eligible for all this stuff. Even with the big, beautiful bill, I'm still eligible for all this stuff. You realize that? And okay, I'm going to have to do a recertification every 6 months or whatever the case may be. But politician, the local, in Casa Grande or Phoenix or Tucson or wherever you are, Mesa, reach out to your politician and say, hey, I went down to the Medicaid office and those guys are way under. So when I have to do my recertification in 6 months, politician, you better make sure there's people there that can do this, because right now, you know, they can barely keep up with the workload they have. And this is across the country. When they get 10 times more workload, stuff is going to be missed. Stuff is going to be missed. And I know there's people out there that say it won't, and they have 100% faith that, yeah, so not buying that. All right, I've got some video questions, so let's get into some of these.
Okay. I am in California. Me and my boyfriend are 58 years old and disabled. Been disabled for over 10 years. I am on SSI because I don't have no job credits. My boyfriend is on SSDI and makes a pretty check. He makes money on IHSS on my account, taking care of me. I was married for 12 years with a previous relationship. That was over 20 years ago. My ex quit his work years ago, and I don't know if he's collecting SSDI or SSI. My boyfriend's SSDI at a certain point.
Okay, so all right, here a dog drinking water in the background. But anyway, okay, so the what she's talking about, the in health services, forget what the act. It's a California. There's a few states that have it. It's actually a really good program. So it says, hey, there's people that are disabled or elderly that really need help, and some states have decided, okay, you know, we can put these people in some type of, you know, assisted living facility or something like that, which is very expensive and it takes them out of their home and all that, which is not good. Or we can save a whole bunch of money by hiring a person to take care of that person. And if it happens to be a daughter or a son or a relative or, you know, whoever that will stand up and do that, then they will essentially pay that person to help that other person out in whatever they need. So it's actually a pretty good program. It saves money across for everybody. But one thing on that one, make sure your boyfriend, I think he was receiving SSDI. So if he's receiving SSDI, that type of thing is still W-2 wages. So he has to make sure that, you know, he stays under the allowable limits of substantial gainful activities. So number one, make sure he's not making too much money, because that is considered still working. He's taking care of you, but he could conceivably take care of anybody. So it's basically like a work type situation. So a lot of people get in that, get caught in that, and then a year or two later, they get this massive overpayment and they get kicked off Social Security. So make sure that is all good there. So in terms of yours, your ex-spouse, if anybody has an ex-spouse that they were married to for at least 10 years, or they were married to when the person passed, they might be eligible for their benefits if you are currently unmarried, and she is unmarried right now. So she could conceivably get benefits on that person's record if that person is receiving benefits or at least 62 years old. Doesn't have to be, the previous spouse doesn't have to be receiving benefits, just have to be divorced for 2 years. If you start getting those benefits and then you remarry, then those benefits stop. But once you remarry, then you can get spouse benefits on the current new husband's record. So yeah, a lot of moving parts there. So, yeah, definitely check that out. Let's see, we've got another one here.
Hello, I just saw one of your clips on TV, and you were talking about the Medicaid cuts and how they will actually also affect Medicare. What I'd like to know is the information that you delivered, where the data comes from. Is there anything written down so that I can use that to go to my House of Representatives and complain about the, in theory, or as you describe it, the cuts are going to happen automatically because of the pay-go system? So again, do you have any written information that's on your website that I can use to go talk to my House of Representative? Thank you very much.
All right, good question. Yes. So what happens is now that the politicians didn't include that in the big beautiful bill, and that's the travesty of it. So what it is here's how Medicare is going to be cut. It's not in the big beautiful bill that they're going to cut Medicare, but because the bill just creates a massive amount of deficit that we're going to give to our kids and grandkids and stuff. So, thanks, I guess, to us. But because there's massive deficit that's going to happen, there's a 2010 law, it's called the Pay-As-You-Go Act. And it says the Pay-As-You-Go Act says, hey, if Congress does anything dumb like that, like increases the deficit, they have to find savings somewhere else. They have to mandatorily cut something someplace else. And part of that act is they can't cut the Social Security and they can't cut the VA. So the only other place they can find money is Medicare. And the guy that is assigned to make those cuts is a guy named Russell Voigt. He is the Office of Management and Budget, one of the architects of Project 2025. He's been wanting to cut Medicare forever. So he is part of it. So in your particular case, I would call up the politician and say, hey, on the very first version of this big, beautiful bill, y'all included in there to not do sequestration, not do the pay-go thing. Y'all included that in the very first one, that pay-go, we're going to cancel pay-go. And then when they did the next version, they took that out. Why did they take that out? And then ask them, says, okay, number one, why did y'all take that out? Is it in there? Is it in the big, beautiful bill, the pay-go thing? No, it's not in there. It wasn't, it was taken out. And then say, okay, so what is on the chopping block? Because you can't touch Social Security and you can't touch, the veterans. What's on the chopping block? And they'll say, I'm sure they'll give you some type of political response. But yeah, politicians, we're playing chess and they're playing checkers.
My name is Janet Doyle. I don't
shy.
want my face on here. I'm in my
That's
pajamas. I'm retired. I received an email from Social Security, bragging that 90% of Social Security recipients will no longer have to pay federal income taxes. What I've read, it's not part of the bill, but this is what they're saying. So if you could just reply back to me and let me know if this is true or not.
Okay, so we just talked about that earlier, that, again, it's that they can't do that in a reconciliation type bill. They just increase the deduction. So if you didn't pay taxes on your Social Security benefits last year, it doesn't help you at all, which about 50% of people don't pay taxes on their Social Security. So it doesn't help you at all, unfortunately. Another shy person.
Hello, Dr. Ed. I was wondering, you said we could get on Medigap. Was that G or N? Is those the two letters that you were told us to question about? If they can help us with that.
Okay, so yes, if you are up to get Medicare, so if you're turning 65 or you recently stopped work and you want to go ahead and sign up for Medicare Part A or Part B or just B, or because you already have A, whatever the case may be, if you're new to Medicare, you need to make a decision. You need to decide how to fill those gaps of original Medicare, either through a Medicare supplement plan or a Medicare Advantage plan. I always recommend you make sure you check, you review both of them. Always start with the Medicare supplement plan, because a plan N or a plan G, and see if that's right for you. The problem with N and G is it has a monthly premium, doesn't cover, those extra dental, vision, and hearing and stuff. But there is no pre-authorizations, there's no network. So I always recommend, if you can get it, if it's in your budget, a plan N or a plan G. Okay. If it ain't, it ain't. It ain't in your budget. So that's why 51% of people pick a Medicare Advantage plan. Well, actually not because they can't afford it, it's because they don't know about it. So that's sometimes Medicare Advantage or Medicare insurance agents, they make more money on Medicare Advantage and the companies make more money. So that's what they kind of steer you to. That's why I chose Chapter. They tell you everything. So yeah, whoever you contact Chapter, whatever, and you're looking for Medicare, just say, okay, number one, tell me what's the difference, what's Medicare supplement, what's the difference between N and G, how much is it, yada, yada, yada. And okay, what about Medicare Advantage now? And get the whole scoop and make the decision that's best for you. If you currently have a Medicare supplement plan, you can actually change those 365 days of the year. If you have a plan G and it's costing you too much money, you can switch to another plan G. You might have to go through medical underwriting, health underwriting. It's just, you don't have to necessarily go get a physical. Usually it's just like, the Chapter person, asks you 20 or 30 questions. And if you have you had a heart attack? Have you had open heart surgery? Do you have, just, general questions. And if you answer no to most of them, you can, switch your Medicare supplement plan. Medicare Advantage, usually for the most part, you can't switch those until October 15th, unless you move or you gain Medicaid or you lose Medicaid. And there's some other situations too. So I'm going to get one of the representatives from Chapter in about a week ago come in and fill us in a little bit more.
Hi. I checked here. My name is Celeste. I was looking at your website, Dr. Ed Weir, and there's someone else where it says $149, talk to supervisor of Social Security, and the name is My Jackson. Does My Jackson work with you? Or is that like an advertisement that's been put above your name? Okay.
Okay. Yes. Yes, that is, let me put it up there. Okay. So yeah, that's that right there. So yeah, that's, I used to do these myself, in order to pay for the website and phones and all that kind of stuff, anyway, but, I just don't have time for that. But I found someone that knows, and she worked, and with the Social Security Administration for a few decades. She was a technical expert. She was the one politicians, representatives, when you contacted your politician and had an issue, she's the one that they would contact because she knew everything and everything. So if you need personal help, if you can't, everything in everything is free. This Q&A is free. Watching the videos, you have to deal with some commercials sometime, but anyway, and the website is free, and the calculators on the website is free, but unfortunately, so we got to pay for it somehow. So, and then is to pay her rent. So if you need to go through your particular thing, whether you're making the right decision on disability or retirement or something like that, you can schedule a one-on-one phone call with her. You just go down there, pick the date and the time. And we just do a very, very limited amount of those. So just very, very limited amount. So, all right, let's do one more question, and because we're way over time.
Was married to my wife for 20 years, and she passed away from breast cancer when she was 44 years old in June of 2005. I am going to be 64 this August, but was going to retire around the following August when I am 65 years old. I was hoping to get your advice on what is my best direction with my situation. I am thankful that you put up this website and also your YouTube videos, as these have been very helpful. So again, thank you for your help.
All right. Thank you for that. All right. Okay. Yeah. Wow. Okay. So, you haven't filed for benefits yet on your own record. You're 64 years old. If you are not working or your earnings is under $23,400, then what you can do, here's a strategy. Because you're a surviving spouse, you can collect benefits on her record, even if it's not very much, or a lot or whatever. So I would contact Social Security and say, hey, if I file for surviving spouse benefits, how much is it going to be? And you find out how much it is, and you don't touch your own record. You just go ahead and, wait until you're 65 or 66 or up to 70 years old. You can go ahead and get the surviving spouse benefits. Don't touch yours. And then later on, when yours gets to a higher amount or the highest amount or whatever, then you go ahead and switch over to your own record. So, and then because you're going to be receiving, so if that's what you choose, or, if the benefits aren't enough and you just don't want to mess with that for whatever reason, then you just go ahead and file for benefits on your own record. And because you're going to be reaching your Medicare 65, if you're working, have health insurance from work, you don't have to worry about Medicare. There is no penalty if you have creditable coverage. That is, it's through current work, yours or your spouse's, and you have at least 20 or more employees. So that's for everybody out there. If you go ahead and file for surviving benefits at, let's say 64, you're currently receiving benefits. And then once you hit 65, then Medicare will automatically sign you up for Medicare Part A and Part B at that time. So you don't have to do anything. So it's automatic. I have a couple of more video questions, but we're way, way, way over time. Big topic today. So I'm going to cut it off here. If you got any other more detailed questions, you can put the video on there, make an appointment with Mai. She can help you out. Please subscribe. I'm going to do another video once more of these details pop up, but now I'm going to leave y'all so I can go back to designing this new website that so we can help each other. All right, y'all take care. Have a beautiful night. Happy 4th of July.